today we are going to discuss about the minor elements. So what is minor element, and what are steps in minor element, and what are the purposes, principles, and we are going to discuss some minor treatment for some minor elements. So myself Anitha, nursing tutor, Department of Community Health Nursing at ES College of Nursing, Villupuram. Here, what is the definition of minor element is: minor elements are generally defined as medical conditions that will resolve on their own and can be reasonably self-diagnosed and self-managed with over-the-counter medications. For example of minor ailments include headache, backache, insect bites, heat burns, nasal congestions. These are the condition we can able to cure at the home itself. We can it is self-managed and self-diagnosed. So what is the principles of managing minor ailments? While managing minor ailments, the community health nurse having a great role in managing the minor ailments. So she should having eyes on the principles of managing minor ailments. So she should ensure a safe and healthful environment for the patient, treat the risk and injured person promptly to prevent any possible complication. In case of infectious disease, take the appropriate precaution to prevent the spread of infection. She should take appropriate precautionary measures for herself and to the patient. And next is keep the continuous watching over the patient's condition and vital signs during the entire period of care. Helps the patient to get well as soon as possible and his activities of daily living. Use the opportunities of health education during the care while giving care of minor element. Then a community health nurse use that opportunity to giving the care, to giving the health education to the people. Always remember the limitations in providing a treatment or follow the physician's order. So while treating the minor element, we should have some standing orders. So the nurse should follow the standing order. Okay. Helps the family members in coping with the situation and prepare them for taking care of sick at the home. Respect the beliefs of the patient. If he has some other therapy for the treatment for his minor element, if the patient is always already having some following some other medication so we don't ask the patient to stop that. So respect the beliefs of the patient if he has used some other therapies for the treatment of his ailments. So what are the classification of minor ailments or general minor ailments and systemic minor ailments? So general minor ailments, it includes common accidents and emergencies which need immediate first aid. So in this category, injuries and falls, fractures, burns, dog bites, high fever, heat stroke, diarrhea, fainting, etc. can be kept. The management is prescribed in further pages. So systemic minor ailment, it includes smaller ailments which affects the various system of the body. Some of them are listed here. So eyes, in that eye accident, foreign body entry, infectious, poor eyesight, dry eyes, blindness, etc. Earache, foreign body in ear, osteotitis media, discharge from the ear, temporary deafness, etc. So in a respiratory tract, allergic rhinitis, common cold, sinusitis, sore throat, cold, cough, dyspnea, chest pain, asthmatic attack, etc. Cardiovascular system, hypertension, anemia, rheumatic heart disease, etc. In the digestive system, toothache, stomatitis, soreness in mouth, constipation, diarrhea, indigestion, vomiting, abdominal distension and pain, intestinal obstruction, hemorrhoids, etc. So here these are all the conditions of minor ailments in the digestive system. And next one is urinary system. In urinary system, so burning maturation, retention of urine, urinary infection and renal stones. These are all the minor elements. Neuromuscular system, headache, backache, convulsion, epileptic fits, etc. In the reproductive system, dysmenorrhea, heavy bleeding, sores and discharge from the genitals, breast lumps, etc. Along with above ailments, behavioral problems like maladjustment or emotional disturbances, etc. may also be included in the category of minor ailment. This or require proper diagnosis and appropriate management. So, what is the general steps in management of the minor ailment? We should follow some general steps while giving the treatment for the minor ailments. So, we are going to see the steps. So, first step is assessment. So, in that assessment, taking the history, performing the quick physical examination, and second one is finding the case, making the diagnosis and planning for the care, and third one is providing a treatment and nursing care, and finally we have to evaluate the care and condition of the patient. If the patient condition is outcome is very successful, plan for the follow-up. If the patient condition does not improve or any having any serious signs appears, so refer the patient for the needful. You can refer the patient to the next referral level. So we are going to see some of the condition standing orders for treatment of minor ailment. First one is fever. For the fever, what is the treatment you are going to give at yourself? So examine the vital signs, that is temperature, pulse, respiration and blood pressure. Gather information about other symptoms accompanying the fever. So as a patient, regarding headache, uneasiness, nausea, vomiting, shivering, cold, running nose, allergy, skin infection, jaundice, fits, cough, etc. So while gathering this information, we can able to diagnose what is the exact type of fever is it. Provide the rest and light meal to the patient. Prepare the blood slide to examine the malarial parasites. So give the paracetamol tablet to bring down the fever. Give lot of liquid to the patient. If the fever is more than 39 degrees Celsius, give cold sponging to the patient. In case of delirium, convulsion, unconsciousness and hyperpyraxia accompanying with the fever, refer the patient to the doctor. That is, refer the patient to the next referral level. And next one is cough. So cough is the most common symptoms of the respiratory diseases. Find out the duration and types of cough, color and consistency of the sputum. Check for fever, sore throat, chest pain, etc. If suspected TB, refer the patient to the hospital for investigation and further treatment. So here a cough is a common symptom of respiratory system. So you have to ask a patient what is the duration of the cough, types of cough and color of the sputum and consistency of the sputum while taking the history. And if it indicates any TB symptoms, you have to refer the patient to the next hospital for the further investigation and treatment. So what is the treatment of cough at the community level? Give the steam inhalation and taking extra fluids will helps to loosen the mucus. Expectorant may be given. Advise the patient not to smoke if he is a smoker. And next one is eye infection. So eye infection causes burning pain in the eyes. Strictly causes the eyelid sticks. So eye becomes red. Treatment. Find out the causes. If condition is acute, clean the eyes carefully and put antibiotic, eye drops and ointment. Cover the eyes with sterile eye pad or soft bandages. Give aspirin to relieve the pain. Refer the patient to the hospital. When any wound that cuts or rupture the eyeball, when painful grayish spots on the cornea with redness, when vision begins to fail in one or both eyes, when eye infection does not respond to the treatment. The next one is earache. So in common earache is common in children. Trouble may be in the external ear or middle ear. Middle ear infection is common and serious. So observe the ear for any discharges, pus and throat infection, pain, cold or too much waxes. So chronic condition may cause a deafness. So we have to take an immediate measure for the ear infection. Treatment for ear infection: clear the ear gently. Instill antibiotic drops 4 times a day. Give aspirin tablet for 3 days. If any foreign body or waxer should not try to treat the condition, this may worsen the condition further. refer the case immediately to the hospital. So if the patient having the eye pain due to the accumulation of foreign bodies or any wax material, you should not treat that patient. You should refer the patient to the next hospital. Next one is toothache. So toothache may occur due to the bad oral hygiene, infections, or in dental caries. So what is the treatment for toothache means? Swelling or fever, give the potassium permanganate mouthwash and health teaching about oral hygiene. Ask a patient to do brushing 2 times a day. If there is a fever, gives aspirin, tablet aspirin, and mouth washes 3 times a day. Encourage the patient to eat diet like amla, orange, lemon for the healthy gums and teeth. So these are all the food items which is rich in vitamin C. It can strengthen the teeth as soon as possible. Next one is skin rashes. So in that cases of skin rashes, examine for the type and distribution and find out the duration. Record the vitals, isolate the patient, give aspirin if fever persistent. So you have to isolate the patient if the patient having any skin rashes, because it may spread to the next patient also, next person also. When there is eruptic fever, example chickenpox, the pass the information to the higher health officials. Next one is wound. So wound or cut or injuries causes the wounds. Here the standing order for the wounds are: wash the wound with clean and boiled water and aseptic solution, apply the spirit around the wound, remove all foreign bodies present in the wound like glass pieces of wood, stones or dirt, etc. Bandage the wound using a betadine. Give the injection of tetanus toxoid, that is TT injection, to prevent the infection. Next one is burns. So after patient may having a burns, try to keep the burnt part of the body immersed in the water. So as soon as possible you should immerse the burned part of the body into the water. Check the spreading of burns. If the cloth has got stuck on the burnt part, do not try to remove it. Through the rings, bangles, shoes, belt and other tight fitting articles should be removed. Do not touch the blisters unnecessarily. Cover the burnt part with a clean cloth. Assess the condition of the patient and the percentage of the burn. In case of diarrhea, monitor the symptoms of dehydration. If the dehydration is severe or the patient is in a state of shock, immediately refer him to the hospital. Provide ORS to the patient. Rice water, coconut water, lemon juice and light tea should be given to the patient. If there is epidemic of vomiting and diarrhea, samples should be sent for the stool test. Food and water should be protected from getting infected, and health officers should be immediately informed as yearly notification. People should be educated about controlling the flies, cleanness of water and food, and proper disposal of excreta. Give the medication as per the need. So as soon as the patient having any diarrhea, or it may be the persistent for many days, so it should be immediately informed to the health officials, because it may be due to the poor water supply or food supply or improper disposal of the excreta, etc. The next one is epistaxis. So epistaxis is otherwise known as nose bleeding. So if the person having nose bleeding, make the patient sit up with head erect and bend forward. Loosen all the cloth at the neck. Ask the patient to pinch nose at the junction of the hard and soft part. Apply a cold compress. Do not let him below the nose. Refer the patient to the hospital or primary health center if bleeding cannot be controlled, or if the patient is elderly. So if the patient is having, ask the patient to sit and with the head erect position. Ask them to bend forward. Loosen all the cloths at the neck, and ask the patient to pinch the nose at the junction and apply the cold compress. The next one is drowning. So drowning, so if the patient after the drowning, loosen the cloth from his chest, make the person lie on his abdomen and get the water out of his lungs. Resuscitate the patient and immediately send him to the health center or hospital. And next one is bites. So in that bites, first one is dog bite. So after the dog is bitten, thoroughly wash the wounds with soap and water. Use running water. Apply the betadine and tincture iodine. If the wound is excessive, check hemorrhage. Stitches should be done only after 24 hours. Give injection TT. Do not kill the dog and observe for 10 days. Send the patient for ARV therapy. It is antiretroviral therapy. Our next one is scorpion bite. If the patient bitten with the scorpion, clean the wound with mild soap and water. Apply a cold compress to the affected area. This may help reduce the pain. Do not consume food or liquid if you are having difficulty in swallowing. Take an over-the-counter pain reliever as needed. You might try ibuprofen tablet to help you easy discomfort. And next one is fainting. Fainting at the CNS. So as the patient lie down and his head should be at the slight lower level than feet. If the person is sitting, keep the head bended between both the legs. So first one is lie down the person, his head should be at the slight lower than the feet, because it's at the lower end, the brain should have more blood supply during at the time of fainting. So you should make the patient slight elevated from the feet. So if the person is sitting, keep the head bended between both the legs. Person should head, then only the person should get the fresh air. Once a person gain consciousness, ask him to take deep breath and give him liquid to drink. If unconscious continues, refers to the patient to the hospital. And next one is injuries and fractures. So after injury, or it may be an open injury or in a closed injury, the patient having an open wound fracture, clean the wounds open water, apply the spirit around the place of wound, apply betadine lotion and bandages the wound using the sterile dressing. Monitor the condition of the patient with fractured bones. Treat the patient for shock. Immobilize the fractured part of the patient's body using a splint or something else. What is this tight, like a wooden stick, whatever it may be. Given analgesics and injection of tetanus toxoid to the patient before sending him to the hospital for further treatment. And next one is hemorrhage. So hemorrhage, if the patient having sudden accident or it is due to some any other type of hemorrhage, lie down the patient is tight on his back, take the BP and other vitals, press a pad on the point of bleeding. So where the open wound is bleeding, so give some pressure to that point. Continue doing this till the bleeding stops. Do the bandaging once the bleeding is under the control. Give him the liquids. Try to find out the cause of bleeding and monitor the state of shock, and in case of bleeding or condition of shock getting out of control, send the patient for the further treatment. Because if the patient having severe bleeding, if you do not send the patient to the further treatment, the patient may go for the shock and may go for the death also. So till now we have discussed about the definition of minor ailment and what is the principle of minor ailment and what are the classification and what are the steps of managing the minor ailment, and we have seen some of the conditions which is treated at the home itself. Thanks for watching.